And so good morning and welcome to this very special live web chat, which is hosted by the Jersey Chamber of Commerce and the Government of Jersey, and gives health guidance for business as we run up towards the Christmas period. I'm very pleased to say we've got all of those main players with us here today. Alex Khaldi, the Director of Public Health, is with us. You'll see on the screen. Dr. Ivan Muscat, the Medical Officer for Health, has also joined us as well. James Lynch, who is the Policy Principal for Public Health. Dr. Clare Newman is with us as well. Rachel Williams is with us as well, and Becky Sherrington as well. So welcome to one and all. Good to have you with us. Alex, before we start, and as people do join us, I see that we have the first 49 or so of the 80 odd who've registered for this, who've just joined us. So thank you very much indeed for that. Numbers will creep up as we go. And for anyone who misses any of this, there will be a recording available, which Chamber will be releasing a link on within the next 24 hours. So it is information that can be relayed to those who couldn't join us today. There is a Q&A box, which you'll find at the very bottom of your screen. It says Q&A. If you have any questions, the best way to ask them, if you're watching this, is to pop those questions in the Q&A box, and you can do so now. Alex, I will hand over to you at this point because I know you have a briefing on the government decisions of this week, and it's probably best that we start at that point there. So over to you. I cannot hear you for a moment. I couldn't hear you. Let's see if we can hear you again.
Good morning. Can you hear me now, Murray?
We can.
My apologies, everybody. My name's Alex Khaldi. I'm the Director of Public Health Policy in the Government of Jersey. I'm going to do a very short presentation on decisions made this week and general public health advice to businesses over the winter period, and in particular in the run-up to Christmas. But as Murray has said, we'll go quite quickly into your questions, and a number of specialists are joining me from the Government of Jersey to help with that, the answering of those questions. I'm just struggling to, there we go. Hopefully you can see my first substantive slide. So we set out a winter strategy about a month and a half ago. We, as part of that strategy, indicated that the Government of Jersey and the island is in a completely different place to where it was last winter. As you'll recall, last winter, we didn't have a vaccine for the first part of the winter, and it was necessary, unfortunately, to impose very restrictive measures to try to control the spread of COVID-19 and the impact that that has on health and mortality in Jersey, which we did successfully, but at a huge cost, I think, to the business community. This winter is very different. We do have the hugely important effect of the vaccine, and so we are able to have a more nuanced strategy going into winter. The winter strategy set out a couple of steps that we would take as and when conditions demanded it, and I'll refer back to those in a minute. But the current context for decisions made this week is we do have continuing high levels of COVID-19 infections on the island, mainly as a result of vaccination, including the booster programme. Our current levels of hospitalisation and mortality are relatively low. But as you'll all know, the Omicron variant of concern, about which we know not enough yet globally, causes us additional concern over this period. And so ministers gathered the day before yesterday to make some key decisions in relation to that context. I said I'd refer back to step one of the winter strategy. Of course, in extremis and at step two, we would reimpose a range of legal measures that we all know about. Our aim over the winter period is to avoid doing so. But step one of the winter strategy, where case rates and other risks are high, is to encourage greater voluntary action. And that's where the thrust of ministerial decisions this week heads. Just moving to my next slide. I'll run down the decisions quite quickly. So the Joint Committee for Vaccination and Immunisation, upon whom we rely in large part, together with the Chief Medical Officers of the UK for advice on vaccination, has issued advice to set out there, decrease the period between a second dose of the vaccine and the booster dose from 6 months to 3 months, to open appointments for booster doses for the 18 to 39 age group, to offer second doses for children aged 12 to 15, and a fourth dose to those severely immunocompromised islanders, of which there are a very small number. The combined effect of all of this, and Becky Sherrington is on the call to answer your questions about this later, is to increase demand for vaccination in the island. Our current rates of vaccination, our uptake of vaccination is very good, but given the Omicron and current high infection rate risks, we wish that outcome to be even better. Vaccination represents the best defence that we have over this winter period, and in all probability, as Omicron spreads towards potentially Jersey. In the Omicron context, we will be reverting to an isolation period for those people where we have identified a Omicron case on island that are direct contacts of the same. And in order to identify whether Omicron is present on the island, we are increasing the sequencing activity that we have been doing for some time now to determine the particular variants and characteristics of positive cases that we have on island. Jersey values its connectivity extremely highly. It's incredibly important to the island economy. And so we've taken, we think, a proportionate, or ministers have taken, we think, a proportionate decision to defend alongside other ground dependencies in the UK as a whole, the common travel area from Omicron infections by reverting to comprehensive testing of arrivals from outside of the common travel area. The CTA arrivals policy, which allows for fully vaccinated arrivals not to be tested at our ports, remains unchanged. We are also going to be issuing, either today or tomorrow, advice to organisers of private events such as office Christmas parties to use proof of lateral flow tests as a measure to ensure that their gatherings are as safe as they possibly can. For the avoidance of doubt, we are not requesting or requiring hospitality venues on the island of any kind to check the COVID status of their patrons, albeit we would of course wish to encourage those businesses to encourage their patrons to carry out regular lateral flow tests. Over the course of the past couple of months, and this is my final slide, we have been shifting our strategy very strongly towards giving businesses, organisations and individuals the tools to keep themselves safe in accordance with their own, if you like, risk management and the particularities of their businesses, households or organisations. And our more general advice remains as is, that we will be seeking to promote vaccination as the very best way for Jersey to become protected from COVID-19, and that will continue with these welcome changes that the JCVI have advised upon recently. We are encouraging strongly the use of masks and would encourage you to encourage your customers to do the same. The question of whether legal force should be applied to mask wearing is still under consideration, but for the time being, a strong encouragement to use masks, particularly in retail premises where contact details can't be or are not required, is very important. LFTs are and knowing your COVID status is crucially important. There really is no reason why any islander shouldn't have access to self-administered tests at the moment. And one way of keeping business continuity running is to impress upon staff in your organisations to continually check their COVID status at least twice a week. Be watchful of symptoms and seek a test, of course. Distancing is not prescribed in our guidance at any particular length or distance, but where possible, it makes sense. And the importance both of hands and premises hygiene is high, as well as particular importance that we now attach, given we know COVID is an airborne disease, of good ventilation. We are not issuing a blanket work from home request for islanders, but we are talking in private sessions like this about businesses sensibly using that option where they can. And to conclude, Marie, Minister's objectives here are to keep Jersey in business in this important trading period, but also to advise islanders and businesses of the actions that can keep them safe. And my colleague Rachel Williams is also on the call, who can help with any inquiries in relation to COVID safety and has some resources in her team that are able to work with individual businesses. Thank you.
Alex, thank you very much indeed for that. That was a very good whistle stop of ministerial decisions that we've had so far. If you've just joined us, thank you very much indeed for doing so. I'm Murray Norton. This is the Jersey Chamber of Commerce hosting this Government of Jersey health advice for businesses. Questions in the Q&A box, please, and we'll try and answer them as quickly as we can. I don't think we've had such a gathering of all of the health professionals at our disposal all in one place at one time, so please do make use of that. Dr. Ivor Muscat is on the call as well, although you do see two pictures of Dr. Clare Newman there, but that's fine. We know that everybody is there. I wanted to ask a question, and I'm just looking to see who is best to talk about this. In terms of the difference between Jersey and the difference between other jurisdictions. And I say other jurisdictions in the broadest sense. I don't just mean those locally to us, although there's a reference there as well, in regard to mask wearing, because I just wanted to bottom out why we're not doing mandatory mask wearing. Not that I'm advocating for it, but we've had questions asked of us. Wouldn't it be easier to mandatory put masks in place so that everybody, businesses and everyone else knew what the rules are? At the moment, we're in this highly recommended, difficult to police, whose job is it within the store to ask someone to put a mask on? If they don't, what's going to happen scenario? So Alex, I'm probably going to come back to you to start with on this one. This was a ministerial decision, so I know that you can't answer for our political masters, but where's the thinking on this?
Well, it's very much under review, as I said earlier, and so the door is not closed on the potential for us to introduce that as an option, and we are certainly in large part here to listen. So I'd be interested in any comments that individuals have in the chat. However, we did indicate in the autumn when we set out our winter strategy that legally binding measures would be more in relation to stage 2 of our strategy. The whole thrust and focus of what we've been trying to achieve is to give islanders the tools and the advice, including businesses, to make sensible decisions. So it is if we were to introduce mask wearing as a mandatory exercise within, for example, retail premises or close contact services, that would be a large step, and it does require continued review and investigation to see whether or not it is proportionate in the current context. We've got relatively low hospital numbers, reasonably high levels of infection, the advent of Omicron, and so we're continuing to weigh that up, Murray. Thank you.
Okay, thank you very much for that. Questions coming in. We'll get Vicky's question in a moment. If you've got a question, the Q&A box at the bottom is where, and in fact, if you've got a comment, then we'd like to hear that as well. Put it in the Q&A box and we'll pick it up quick as we possibly can. You mentioned Omicron, and who knew that was the 10th letter of the Greek alphabet? But we learn new things each and every day. Omicron, I'm going to go to Dr. Ivan Muscat on this in terms of scientific evidence. What do we know about Omicron? Because I've read just this morning bits and pieces which in one place in South Africa it's being reported that nobody's been ill from Omicron, nobody's been hospitalized from Omicron, and they're in South Africa scratching their head as to why the UK government in particular are hitting it so hard when it doesn't appear to be having any effect. And yet we're seeing people getting very nervous about it, and rightly so. So do we know much about it at the moment? Are we just taking precautions?
We have only got limited knowledge of Omicron at the moment. We certainly know that it is 32 mutations different from the original wild type variant. And by comparison, Delta, which is what we currently see circulating in Jersey, in England and so forth, is about 18 mutations different. And it is because of this relatively large difference that people have sat up and looked at it and wondered whether these differences are going to endow the virus with difficult characteristics, like, for example, increased transmissibility, increased severity of disease, and evasion of protection created by either past natural infection or vaccination. We don't really have laboratory or epidemiological answers to those questions. That is the characteristics of this variant in real life. Those will be coming through over the next 2 or 3 weeks, I guess. We do have some information and some speculation. The current evidence is that the growth rate of this variant in South Africa is faster. That is, the amount that we're seeing is faster than the amount that we saw with the Alpha and Delta variant over the same period of time historically. That doesn't necessarily mean it's more transmissible. It may do so or it may not. It certainly has been found in a number of continents outside Africa. It's been seen in various European countries, in Canada, and therefore North America and Australia. And it's also been noted in Hong Kong. There is some thinking about what we're seeing. So, for example, although the mutations have affected certain very important sites on this spike protein, these changes have also been seen by past variants. They've been seen with Alpha and Delta. Although vaccine efficacy has been affected to some extent by changes in these areas in the past, the vaccine has continued to be effective against Alpha and Delta, as we know. So many are surmising that even if there is a reduction in efficacy, that reduction will hopefully not be too great. And therefore the corollary is we need to vaccinate at pace, not just to stem the threat from Delta and winter, but to stem the risk from Omicron. So the importance of rolling out the vaccine as rapidly as possible has, if you like, increased as a result of this variant, to play safe. And we also need to slow down until, certainly for the moment, because it's important to be cautious, to slow down the acquisition of Omicron in jurisdictions outside those already affected. And that is what Alex has kindly described earlier on. We will be testing more and sequencing more in order to take greater care. But general NPIs will also help both with winter and this emergent variant. Thank you.
I'm glad you touched on that in terms of vaccination, which obviously is an essential part of the program that you have, and getting that booster out to everyone. We've had lots of questions from people saying, if this is a variant, what's to say this vaccination will be of any use whatsoever in stopping Omicron? I think that's a fair question. And you know, what we're saying is it's going to be better having the vaccination booster than not having it at all. Is that where we're at?
Absolutely. So the current vaccine certainly is effective against the variants that are currently with us. Mm-hmm. They're still with us. They're still there. They're still causing problems. And the current vaccine is effective against it. Secondly, the changes in this new variant affect the same areas of the virus that we've seen with past variants. They just affect them in different ways. And it is therefore thought that in the same way as the current vaccine has been effective against past variants, it will be effective against this new variant, possibly not to the same extent. We don't know yet. We need to see. It may be to the same extent or not, but we need to see. But vaccination, if you look at the evolution of the pandemic, it is vaccination that has had by far and away the biggest impact on the health burden of COVID and on the general community burden of COVID and the economy. Right. And we also know that vaccination, that the protection from vaccination wanes with time. So the booster program is designed to deal with that waning and boost people back up to the higher levels of protection that you see early on after a dose of vaccine. And that will be hugely important, not just for winter and general variants, but also the new one. The more protection you have, the better off you are. Obviously, we need to confirm that the vaccine is active against Omicron. But we presume it will for the reasons I've mentioned.
Thank you very much indeed, Ivan. Thank you for that. Becky Sherrington, I know you're on the call with us, certainly in audio, if not in vision. Becky, just in terms of vaccination, before I go to some questions from Vicky and from Amy, which I want to get out to everyone, are we ahead of the curve from, if we look at other jurisdictions in terms of vaccination? Are we in such a strong place at the moment that it makes us able to cope with voluntary mask wearing, and are we in a good place? I'll stop it there.
So I think actually you could split that into two questions. So the first question is are we in a good place in terms of our vaccination rate? And we are, and we've had a really good response in terms of both first and second doses. And then, as most people are probably aware, we are also doing boosters. So booster rates have been really high. For example, in the 80 plus, we've done 89%, 75 to 79-year-olds done 90. So we're in a good place. And internationally, that puts us in a very good place too. We've had the availability of boosters, which has been very good, and that's put us in a positive position. And internationally, our delivery rate is high. So we're in one of the top performing countries internationally to do that. So that's a great success for the island and has put us in a very good place. However, that doesn't put us in a complicit position. We need to also continue to vaccinate, and the advice from the JCVI this week is that we need to extend that down and do a belt and braces type approach to make sure that everybody above the age 18 receives a booster, and those 12 to 15 also need a second dose. So the advice and guidance has changed this week, and we will be announcing this week when we are going to be opening up to accommodate those additional numbers to our programme. And we're working on an operational plan at the moment to do that, to make sure we remain internationally in a really good place too. So a further announcement will be made this week on the dates for those cohorts which have recently been opened to.
Right. Thank you for that. Before we move to talk about our gateway to the world and our ports, and I'll bring James in on that, I just wanted to touch on a couple of questions that have come in. They're very similar from Amy and from Vicky. I'll read Amy's out first. Whilst I appreciate the guidance is yet to be issued with regard to events, could you please confirm what evidence you might expect event organisers to collect from event holders? Is it simply positive, verbal or electronic confirmation that they've had an LFT and that they're fine? Or do you expect businesses to see evidence of a test itself for people? Now, you know, I'd speak on behalf of the Jersey Chamber of Commerce here. We've run 3 successful events in September, October and November, where we asked people to consider taking lateral flow tests. We got lots of nods from people saying, did one this morning as they came in. Is that enough, or do we need to have someone on the door saying, sorry, can I just see your test first before you come in? Now, I know you cleared that up by saying you're not asking for that from a government or a legal perspective, but you know, what should organisers be doing here? And Alex, I know your camera's back on, so you're ready to jump in there as well. And I'll also come to Rachel on that as well. So Alex first.
Well, I think the first thing to say, and just to be really, really clear, that we're not asking hospitality businesses or any of those types of organisations to do this where they have regular flows of customers night by night or week by week. So this is for aimed at social organisers or organisers of, if you like, Chamber of Commerce social events. And I think what we're seeking here is not to make those events more difficult to arrange, but we're seeking to make them safer, and we're seeking that organisers do more strongly remind the attendees that taking a lateral flow test is the right thing to do, the good thing to do. If the organisation maybe wishes to receive confirmation from people, either with evidence or without evidence, depending on the kind of organisation and how well people know each other, that those tests have been performed, then that would be adequate for the purposes that we're describing. And I think it is for whether you, in the context of the Jersey Chamber of Commerce or a club or a society or a workplace, to use the bonds of trust that they have between them to ensure that people aren't just sort of hearing the advice of taking an LFT and then, if you like, sort of forgetting about it or ignoring it. But there is a step in the process. It might be confirmation on trust, or it might be a photo of the LFT with the date and name on it, or it might be rendering of the email one gets when registering a negative test on gov.je. So what we are not saying here is there are hard and fast rules whereby government is micromanaging how this should be performed. But in a world where we do wish for events to be safe, we don't wish for events to be super spreader events, we do think organisers of those events need to take a little bit more care to ensure that those LFTs are performed before the night out or what have you.
I mean, as you'll well know, and as I know, there are those that won't take an LFT. There are those that don't wish to take one because they just think it's not for them, and they will rile against it, but still want admission to that event. What you're saying is it's up to the organisers to decide whether that's good enough for them.
Yeah, we don't want people that are organising events to get into significant conflict with their members or with their friends as a result of this policy. The aim of public health is to increase the use of LFTs in this context, and so we'd encourage people to be using appropriate mechanisms to remind and to cajole people into taking those LFTs without, if you like, getting into wrangles or arguments or trouble that they might otherwise not have got into. And so, you know, for those people that have a principled position against taking the vaccine or whatever it might be, we encourage people not to significantly engage with that and to do the right thing themselves and for their organisations. But we are not wishing to micromanage the policing of these types of events, or indeed for event organisers to do things which make them feel and their friends and colleagues feel tremendously uncomfortable and cause conflict of that sort. Murray, you're on mute.
Do you know what? You beat me to it. I was just going to press my button. Thank you. Thank you for answering that, Alex. And Rachel, if you want to jump in at any point on some of this, because I know vaccination is in your particular area. In terms of COVID status. And Vicky asked a similar question on that, which was, was around the clarification on events not being hosted in a hospitality venue. So if it's not in a hospitality venue, and there will be an awful lot of people gathering at this time of the year, Rachel, does the same apply here in terms of people organising an event that might be at their house, going around with friends, that sort of thing? It's going to happen this time of the year, isn't it? People are going to see people.
Yeah, absolutely. I mean, we're all looking forward to a more jolly festive season this year than perhaps we enjoyed last year. And we very much are encouraging all islanders to take a lateral flow test before they go to someone's house, before they go out to the pub, before they meet up with friends, before they go and see more older relatives or people who might be a little more vulnerable. Of course, it's not mandatory, but we are strongly encouraging it to keep yourself, your friends and your loved ones safe. The home testing programme is still open. People can still go online and register. It's completely free. Those kits get posted to your home. And then you can choose when you take those lateral flow tests so that you know your status before you go on one of those social events. I agree with everything Alex said. It's not mandatory. We don't want to constrain or force or cajole people, but we're just strongly recommending it to keep ourselves and our loved ones safe. I think probably any of us that have been out on a rare social event and then been pinged as a direct contact afterwards, I think once it's happened to you once, you're probably more likely to encourage your friends to take a lateral flow before you go to a meal or to a pub. Just to guard yourself really from being identified as a direct contact and from being at risk.
Yeah, I think the conversations I've had recently is if everyone sitting at our table has had a lateral flow and is fine, and we're mixing with the people at our table only, then we're reducing our chances of getting pinged, and we're reducing our chances of passing on. Somebody anonymous has emailed in to say, my employer sponsors a Christmas party for its pensioners. We mandated compulsory lateral flow tests several weeks ago before the attendance of this event and advised people to consult a health professional before attending if they have any underlying health conditions. Finally, hand washing and masks must be worn when not eating. Are there any other further controls that we should consider? Anyone who wants to jump in on that, any further controls? I suspect distancing is the only thing we haven't mentioned there, wherever you can. But Rachel, is there anything to add to that, really?
Yeah, I think they're all really good recommendations. So in terms of COVID safety, there are a few recommendations. So making sure that cleaners are using the correct techniques, that they're using chemicals, cleaning products that are EN 14476 compliant because they are antiviral. EN 1276 is antibacterial only. Making sure that cleaners are changing cloths and using different cloths for different purposes. And we've seen some of that where cleaners are using the same cloth for different purposes, which of course is never really advised. Making sure that everyone is washing their hands before they're eating, that the surfaces, the tables and the like are also sanitized and cleaned before eating. Making sure that we're sanitizing any touch points, so handles and particularly door handles. If you're in a kitchen environment, some of the places where we find that the highest infection risk are things like microwave touch buttons, kettle handles, fridge handles, and the lids of coffee pots, because people don't tend to wash their hands before they open the coffee pot. They may wash their hands afterwards. Encouraging people to stay at home if they've got symptoms or if they're feeling unwell at any time. Go online, book yourself a symptomatic PCR, look after yourself. and maintaining your safe distances, exactly as you said, Murray. The one that surprised me, but I've always got it in my mind now, is if you're going to an event where it's buffet self-service, just be aware when you're touching those buffet spoons, those serving spoons, and then you might go to your table and put the food into your mouth with your hands. If the person before you has also touched those serving spoons and they haven't washed their hands and they've got COVID, you may be at risk of putting their COVID from the serving spoon straight into your mouth. So I'm always now really cautious if I ever go somewhere with a buffet. I'll serve myself and then I'll wash or sanitize my hands and then I'll eat.
Okay, some good protocols for those attending and also for those who are running those events and businesses with buffets. So good information. Thank you, Rachel, for that. Dr. Clare, in terms of COVID status certification, it's not required in the island for us to show well, in France, a passe sanitaire. How about that? Before you go into a bar or go into a restaurant, anyone who's been to France any time in the last 6 months will have seen this, and it still continues today. Show your COVID status before you go in. Now, I know that I don't want to steer into the whys and wherefores of why our government have decided not to do that. That's up to our ministers to decide. But I just wonder if that's a very good, safe protocol, that those that are in these, and I know there's exclusions to that people that can't have vaccinations, but it seems to work there. And I just wondered, has that been a consideration over time?
It actually might be something that Alex might prefer to come in and answer, but at the moment it isn't something that our ministers are considering, and we know it has worked in other places, but we also know it's been met with quite a considerable resistance, so it's not something that we feel is necessarily correct for Jersey at this point. And it's not something that the ministers are keen that we pursue. But I don't know, Alex, if you wanted to come in on that one as well.
With Murray's permission, I will. Thank you, Claire. So it's important to recognise where France started in terms of weak supply of the vaccine, but also a public mood that was not as strong as in Jersey to become vaccinated for a variety of different cultural and historical reasons. And so passe sanitaire came about because of the need in France for the government to encourage vaccination in a more classically incentivised way. We have had, as Becky has set out, relatively good levels of islander support for the vaccination programme. So I think as long as that continues, we and ministers would be very cautious, I think, about imposing controls on liberty and personal choice on an in-island, in an on-island context in the way that France have done. And I think public sentiment suggests that ministers are on the side of the public in that. It's a different context at the border, and that's where COVID status certification, I think, has had a good and powerful effect over time in terms of the work that Claire and others have been leading. We don't rule out any of those policy options for the future, but we have not quite had the sense of a problematic relationship with vaccination that we saw in France at the start of the vaccination programme. So that would be my explanation, Murray.
And a good answer. Thank you for that, Alex. Thanks for stepping in on that one. James, in terms of ports and looking at the changes which we now see, we now have a situation where if you're coming into Jersey from anywhere other than the UK, it's a PCR test and isolation until you get the results back of that, a negative back from that. Is that turnaround still pretty quick? Can people expect to get that? Well, they were used to getting it. People were posting up, I've had my results in 3 hours, 5 hours. It's amazing. Is that still likely to be the case?
Yes, hello, Murray, everyone. So obviously we had to react quite quickly on Thursday with the Omicron threat and the introduction of the red list countries from the UK, and again on Sunday with the addition of the 4 additional countries. And it was as you know, having spoken to you many times about this over the course of the pandemic, we've been through a number of iterations of the travel policy, and we had, since early November, arrived at what we felt was really quite a settled and simple process in terms of COVID status certification. So it was a shame that we had to return to increased border restrictions, but that was essential given the alignment with the rest of the CTA partners. So in answer to your question, there will be no change to the test turnaround times. We're achieving very, very good test turnaround times, and that's in part due to the transition of the laboratory facility to the in-house hospital facility. So that so passengers who it might be helpful just to clarify in terms of the non-CTA. So anyone who's travelled will know we have a 10-day travel history collection. From the 2nd of November, we were able to effectively switch that off because we had no geographic regions of concern. So that was switched back on Thursday. So passengers there will be a 10-day travel history collection. It's not as complicated as it was previously. And that will be to identify anybody who's A, been in any red list countries, and B, within that 10-day period, who's been outside the common travel area. So if, for example, islanders have travelled off island to visit family further afield in the common travel area and return, they will be subject to what was the old green regime, is probably the best way to describe it, of a single test and isolate until test results. And just to reiterate, there will be no, we hope, we plan, we're not anticipating any lengthier turnaround times for the test results than we're getting currently, which are excellent turnaround times. I would just like to push out there that the option of a pre-departure test remains open to people who've been outside the common travel area in the 10 days. So if passengers passengers have the option to declare evidence of a negative PCR test, must be a PCR test, I'd reiterate, within 72 hours of arrival in Jersey. Even if they've been outside the common travel area, that will suffice for our arrival purposes. They can avoid the arrival test and the isolation period. But that is the only way they can. So the requirement is regardless of vaccination status and also regardless of previous positive infection. So I hope that just clarifies.
Thank you. Thank you very much indeed for that, James. Good to clarify that, and good questions coming in. Please keep them coming in. Somebody asks, why only last week and previously guidance was that a booster jab should not be administered. This might go back to Alex or to Ivan. Why only last week or previously guidance was that a booster jab should not be administered any sooner than 6 months after the second dose. And now it seems acceptable only after 3 months. Is there any medical risk or gamble by reducing the timeline? And why the sudden shift if it's not proven that the vaccination would be effective against the new variant? So a couple of questions in there. Ivan, I see your camera's back on, so we're coming to you on this. So we've shortened that time between second jab and booster jab. Is that okay?
Yes, it is. So the reason for recommending 6 months between the second and the dose and the booster was that this was based on waning of immunity against Delta. If Omicron is more likely to evade the immune system, the immunity gained from vaccination at natural infection, then maximizing your immunity will provide a better defense. So waiting 6 months may be too long to allow for that defense to be maintained. Going in at 3 months will better allow us to rebuff Omicron if it has the ability to partially evade vaccine protection.
Right. Thank you. I think that answers that question pretty completely, pretty conclusively. Ivan, thank you for that. Vicky's just come back to us. She did submit a question earlier, which she does say was similar to Amy's, but she just wants to clarity over the communication of negative LFTs as advised. What communication is required prior? Is it just simply asking attendees when registering if they have had or received a negative test in the last 24 hours? If not, how do we manage confirmation of a negative LFT? So just some clarity on that from whoever wants to step up for that one. Alex, yeah, camera's back on there. Yeah, quick on the button today. So let's just go through this just for the sake of Vicky, because she wants to know this. Prior to the event, what communication should she be sending out, and what confirmation of a negative LFT should she get? And there is a supplementary to this actually from Amy, who says, doesn't this make it special category data if you're sharing something from the government site? So a couple of questions in there, one on data protection more than on the results, but I'll let you answer.
Well, the guidance that we're hoping to issue today or tomorrow will clarify the data protection point, but so I'm not going to comment on that just at this point in time, Murray. But what I will say is there are 2 or 3 proofs that can be generated. One is the response from your registration of a negative test. The other is a photo or the actual test itself in terms of showing that proof. I think it is, you know, we're not requiring anybody to do anything in this regard. We are suggesting, in accordance with the type of group that it is and how well people know each other and the level of trust that exists between the group, that there is a step that organisers take to encourage and ensure that people have got the message to take an LFT test before they attend the event. And I'd leave it up to those event organisers about whether they wish to have everybody's proof set out. Photo of an LFT with the data name on it would be one method of doing that. Whether they wish to check on a sample basis, which might be more appropriate for larger events, or if they wish to take it on trust within that grouping that everybody's done it, and you know, it really has to be what feels right and appropriate in the context of that particular group. So I think it is a shift and a transition which we'll all need to try to be making over a period of time. So I'm really wary of setting out particularly hard and fast rules about how this should be performed. But I do think we just need to normalise the LFT test should be and can be in every cupboard, in every house in Jersey. We have to get used to event organisers asking that people remember to take their LFT, and being prepared in occasional circumstances to provide the proof that that's been done. Yes, no hard and fast prescription about how it's going to be done, but the guidance will set it out, and please watch out for that on gov.je over the course of the next probably 24 hours. Thank you.
Thank you for that, Alex. We are moving to a point. I'm just looking at the time now. We've got about 10 minutes left. So if you've got a question, now is the time to pop that question in the Q&A box, and we'll try and get it answered by our healthcare professionals who are all here to answer your questions following the government changes. And as we move into the busy period, the run up for Christmas. Now, one thing that happens in the run up to Christmas is we all do a bit more shopping. And hopefully, for the sake of our local retailers, we're all going to be doing some local shopping. I know that the Royal Square's been busy over the last week, and that's good news for those artisans who are there. Advice for the businesses, if I may, and I'm looking around our highly motivated healthcare team here. I think it's probably coming back to you, Dr. Clare, and probably you, Rachel, as well. Just in terms of businesses, if you're in retail, you're going to be coming in front of an awful lot of staff. And the safety of those staff is going to be paramount for their employers and for their families as well, as they are public facing. So wearing a mask presumably is one of those steps that they need to take, but there'll be lots of other protocols that businesses should be taking for their staff, and the staff themselves should be taking. So can we just run through some of those? And I'm open to whoever wants to switch on. Rachel, you're straight up there, and I thought you might be, because you mentioned some of the right chemical products that they can use, antibacterial and others, that will wipe out the spreading of the virus. So let's just take that a stage further now. You mentioned the coffee room. We know from history of the last 12 months of doing these webinars that the coffee room and the cigarette break area and the collection area of a staff room are quite a dangerous area, because front facing they tend to be safe, but not when they're behind the scenes.
Yeah, absolutely correct, Murray. And I think it's the same advice to all businesses, to make sure that you are cleaning using cleaning products that are EN 14476, because they are antiviral, that you are using different cloths for different purposes, that you are frequently changing cloths, that staff are washing their hands before they sit down to eat, that you're sanitizing those surfaces, those tables. And as I said earlier on, just be really aware of where people will frequently touch items, particularly in a kitchen, in a staff canteen, as you say, a cigarette break area, where multiple people might be touching those points. Making sure that they are washing their hands before they eat or drink, and that you are cleaning those touch points frequently, particularly microwave buttons and the tops of coffee pots and milk cartons and fridge handles. They do tend to be the places where people are, they're going to make themselves a drink without washing their hands before they start, and so that they are the places where the virus can tend to gather. And of course, these protections that we're suggesting against COVID also help to protect against other winter viruses as well. And it is so important, isn't it, that we keep staff safe, and that we can keep businesses running, so we can keep Jersey in business over the Christmas period. The other thing, of course, is those lateral flow tests. So making sure that we're encouraging staff to take lateral flow tests regularly. And that they don't come into work if they're feeling unwell, because that's one of the other things that we found. People are so committed and dedicated, and they want to come into work even if they're not feeling well. But actually, if you do that, you could be running the risk of infecting the people around you. So it really is better to stay home and look after yourself and book in for a symptomatic PCR test if you've got any symptoms.
Switch my mic back on. Just wanted to touch onto the lateral flow tests in terms of businesses. We do hear of a lot of businesses that are doing lateral flow tests twice a week. Now, there's a lot of debate as to what are the best days to do this. They're finding that a Monday is definitely a good day because it's straight after the weekend, and that makes sense. And then probably later in the week, a Thursday or a Friday. Are these open, these lateral flow tests? I remember being on a call ages ago where someone said, we could have a warehouse full of these, and if they're not being used, they're not of any use whatsoever. So can businesses get hold of lateral flow tests for their staff so they can make sure that's part of the work schedule they're available?
Yes, so we've now got 3 lateral flow programs running all at the same time. So there's the home lateral flow program, where you as an individual can go online and get those test kits posted to your home. We've still got the school lateral flow program running, so that could be for teachers or school staff in any education environment, and for those secondary school pupils. And we've also still got the workplace lateral flow program running. So again, if you go online on gov.je, you'll see information on there about all of those lateral flow programs. We've got, I think, about 1,600 businesses that are already registered for the workplace lateral flow program. But if you go on there as a business, you can register your business, you get a code, you register the people in your business, and then you'll get those lateral flow kits delivered to your business, and you can use them, as you say, at least twice a week to make sure you keep your staff and your customers safe.
All right, thank you very much indeed for that. Obviously, we want to keep businesses open, which is what much of this campaign over the last 3-4 weeks has been about. And who are we at Chamber to argue with that? That's exactly what we want, is to keep business operating, but keep it operating safely as well. And the ports are going to get busier, James, as we move up to this Christmas period. There is going to be a lot of reuniting of families. And that's going to mean more people are going to need to, one, have that PCR test when they arrive. But if they're coming from the UK, which is the largest part of our travel flow from north to south and from south to north, there's no restriction in the common travel area. So what's your advice to people receiving family and friends into the island coming up to the Christmas period? Get lateral flow tested?
That's a good question, Murray. Yes, again, just to clarify, the pre-existing rules, if you haven't been outside the common travel area, pre-existing rules apply. So in the majority of cases, for people who, the criteria that's met is the fully vaccinated status. There's no test and isolation requirements. So just to clarify, if people have been or are going to the UK solely and they've only been in Jersey, or they have family visiting from the UK or the Republic of Ireland, it's important to emphasise as part of the common travel area, the pre-existing COVID status certification travel arrangements apply. So we're saying that it's for people who've been away off island and have returned. That's one of the points where we'd say that it's not a bad idea to do a lateral flow test, in the same way as if you're going to an event, in the same way if you're going to visit friends or relatives, or particularly elderly or vulnerable friends and relatives. That's a good point to do a lateral flow test. And similarly, if you've been away, that is a natural point to do a lateral flow test also. And similarly, the same for visitors from within the UK. There's good availability of lateral flow tests in the UK, and asking somebody or suggesting somebody does a lateral flow test before they travel to the island is just sensible, common sense approach. The lateral flow test, as I think you said yourself earlier, Murray, it gives you that additional confidence about the group you're in, and ability. It gives you that additional confidence, not complete confidence, but it gives you some confidence to continue with your day-to-day life and minimise the disruption of COVID. So I think that's how I would couch it.
All right. I think we're just about out of time. We haven't got any fresh questions that have come in, and we seem to have answered most of the questions that have been answered down there. So at that point, I'm going to say thank you very much indeed to all of our contributors, all of those watching. But there are lots of emails and addresses and guidelines on the government websites that people can point towards. In fact, I'm looking at someone to pop up and tell me exactly what they are, and I know someone will do in just a second. But there is plenty of advice on the gov.je website for businesses and for those people who will be heading out for events, or in fact, organising events over this period as we head up towards Christmas. Alex, I'm going to give final word to you on all of this, if I may. Thank you on behalf of the entire team. I know it's a busy period for you all in doing what you're doing in the run-up to Christmas. I'm presuming that we've still, as you said, got lots of almost, is it daily reviewing that you're doing of what the situation is, temperature checking where we are, and making adjustments as we need to go?
We are daily reviewing. We have been almost for the past 18 months. And so, as you know, there's huge effort going on inside government. But, you know, I'll finish where I started, really, which is the approach of government has shifted. Clearly, we need to be concerned about Omicron, but we will not overreact to that. We wish businesses to have a successful trading period over this coming month, and we think with the tools and processes that we've been able to put in place, that we're very hopeful that can happen. And I'd probably conclude with a big thank you to all of those that have attended and have been listening. I think the response of Jersey businesses in the context of COVID has been absolutely exemplary. And one of the reasons why over the whole of the COVID experience, Jersey has been able to manage the pandemic with lower levels of restriction and higher levels of the island spirit, if you like, in terms of doing things to keep everybody safe, and let's hope, and I'm sure that will continue. Thank you.
Thank you, Alex. Thank you very much indeed to Alex, James, Rachel, Dr. Ivan Muscat, Dr. Clare, Newman,